theoretically anything could get through the skin. The outer layer, the epidermis, is basically a huge brick wall of dead skin cells or dying skin cells that is our armor. So its whole job is to keep those things out that are harmful. And then there's an amazing immune system too. So right under the epidermis, you've got your immune surveillance always going on. So if anything does get through your brick wall, you got your immune system there to quickly grab things up. One of the big examples recently in the news is sunscreens. People are very scared to put sunscreen on their skin because of the absorption of chemicals. I'm a redhead. I've got melanoma in my family. I still put sunscreen on. I stick to, again, things with very few products, so zinc and titanium based products for my sunscreen, and I avoid all chemicals because I don't want to absorb them. I don't want to get a reaction to them. I would say, the greater body surface area you're applying things to, the higher risk that you're going to absorb them.
That was Dr. Brooke Walls, and she's today's guest on the Alter Your Health podcast, your source of information and inspiration to promote the holistic transformation of your health, our health, my health, and the health of our planet. And my name is Dr. Benjamin Alter. I am the host of this podcast. I'm a licensed naturopathic physician, for those of you who don't know who I am yet, and I practice holistic lifestyle medicine all over the world, all online through our online platform at Alter Health. And you can find out more, learn more, and get on the schedule to learn how we can support you in identifying and removing the obstacles that are lying in the way of you and your health goals. Get on the schedule at www.alter.health. Today's guest is, like I said, Dr. Brooke Walls. She is an osteopathic physician, a plant-based doctor, and a dermatologist. So we talk about holistic health and medicine, and we talk about the skin. Dr. Walls is local to my area here in Colorado, the Roaring Fork Valley. She practices in Aspen and also Glenwood Springs. And it seems like it's really cool how she, weaves both the surgical intervention of skin cancer and stuff like that with pharmaceutical approaches for other skin conditions, but all on the foundation of lifestyle medicine, understanding how we can really support thriving and healing from within sustainably. So we talk about the most common skin conditions, which are acne, eczema, and skin cancer. All have similar things going on, of course, underlying, and we talk about how to address some of the underlying issues that cause acne outbreaks and eczema flares and things like that. And we also talk about the sun and sunscreen and sun protection and how much sun we actually really need to convert vitamin D to its active form within the body to provide all the health benefits that vitamin D does offer us. And I learned something today, you guys. I learned that we actually do not need as much sun exposure as I thought, at least if we are in the right latitudes, which we talk about as well. So lots of good information in this episode. Oh yeah, I also wanted to mention that we talk about this product, this supplement that actually my father-in-law's company creates, and it's called HelioCare, and it's an extract of a fern that grows in South America, and it's a really high quality antioxidant which supports the body in antioxidative ways, specifically in healing from sun damage and stuff like that, and preventing skin cancer. So there's a lot of great research about this product. I'll put a link to the product on the show notes page, which by the way will be at alter.health/episode 182. And you can also learn more about Dr. Walls and her clinic at aspencosmeticmedicine.com. She also does some telehealth consultations that have to do with supporting you in healing skin conditions naturally. So lots of good information packed into this one, you guys, when it comes to diet and lifestyle and stress and how that comes through our skin health and what we should know about putting things on our skin and what we should or shouldn't put on our skin. So much information from Dr. Brooke Walls in today's episode. And before we dive in, just one last reminder, if you have not yet done so, I would so appreciate if you hit the subscribe button wherever you're tuning in from, whether you're watching on YouTube or listening to the audio. Hit the subscribe, leave a rating or a comment, a thumbs up, whatever it might be. I do appreciate that feedback. And maybe send this episode or any other of the Alter Your Health podcast episodes to a friend or loved one, someone who could use a little dose of inspiration to support their health, their immunity during this socially weird, isolating, and distancing time that we are amidst right now in our world. Which, by the way, we're going to get through this. We're going to get through these crazy times, this coronavirus stuff. It's going to be a historical event, and we, the human race, the culture, our society is going to be healthier and stronger for it. We're learning a lot through this process. I know we are. So without further ado, I could go on my rant and ramble, and I'm not. I'm going to let you all take a breath, let it go, and enjoy this wonderful conversation with our guest, Dr. Brooke Walls. And thanks for being with me.
Yeah, thank you for having me. I'm excited to be here.
Yeah, we are kind of neighbors in the same community, same valley, but our paths unfortunately have not yet crossed all that much, but we are very much in the same bubble when it comes to health and lifestyle medicine. And obviously your focus in your medical practice is focused, and your specialty is dermatology. And I haven't had a dermatologist on the podcast yet. So I'm really happy to connect and learn about your specialty. And I thought it might be a good place to start, just hearing your story about how you kind of landed in your specialty as a dermatologist.
Okay. It's funny that you asked that, because today is actually match day. So all the fourth year medical students match into their specialty today. So it's actually a really big and important day for residents and doctors it kind of decides where they're going to go in life. So I actually had a mentee that texted me today and said that she matched into dermatology. So it's kind of exciting and kind of got me reflecting already today. But I went to med school, I would say, first of all, to help people and to be an effective change. And I chose to go to an osteopathic school because it was more holistic approach, really thought outside the box, incorporated diet, health, Eastern and Western medicine, but still in a very Western medicine base. And so that was my goal at first, was to study, an osteopathic approach to medicine. And then I'm very procedural and creative. And so then I was very drawn to dermatology because it's recognizing patterns a lot of times, whether it's with rashes or with skin cancer, or even with histology. We look under the microscope a lot and look at skin cells. And all of that is very much pattern recognition and beautiful. So I was very drawn to that. And so, I kind of pursued dermatology early on and was lucky enough and fortunate enough to get the opportunity to do this, because it's there's very few training programs, and sometimes you just get lucky, and it's supposed to be where you're at. So
Totally. I've heard, that dermatology is kind of, speaking of the residency and the matching, is kind of the more competitive specialty, right?
it is. It's insane. Yeah. There are very few programs, and you don't always have to be like the best in the top of your class, but it definitely helps. You have to have research. You just have to really be aggressive in a certain way to get what you want. And that's not always my personality. So it was very, very much a struggle for me to be kind of in that aggressive environment and really pursue it, but still be true to who I am. So
Hmm.
yeah, I feel really fortunate to be here
Yeah, that's
doing
awesome
what I
that you
love.
are still who you are and maintained your gentle
Yeah,
characteristics and personality through it.
you can do
Uh,
it. You can do it.
so, where did you go to medical school and then residency?
I went to Chicago College of Osteopathic Medicine. So I spent 4 years in Chicago, and we rotated throughout the city, some of the inner city hospitals, which was very eye-opening, a fabulous education. And then I did my residency in Florida, right around the Tampa Bay area, um, where all the people are still hanging out on the beaches, I suppose.
Still
Not
spring
practicing
break.
their social distancing, if you've seen any pictures. But it was a good place to practice dermatology, lots of pathology there. So I really had some great education. And then I did a fellowship in Boston at Harvard, and that was a cutaneous oncology. So I specialized in skin cancer, basically, just rare forms of skin cancer and approaches to treatment and research. So
Very cool. And
yeah.
then you landed back in Colorado, your home state, and
Yeah,
here you are.
almost. But we took a side trip to Alaska for 3 years. So
Okay,
my husband and I went to Alaska, Fairbanks, Alaska, and I worked there at a clinic. And then we made it home.
beautiful. I'm
Yeah.
glad you did.
Yeah.
So, on the topic of dermatology, I think that it's so interesting to me how a lot of people have like so much pathology potentially going on inside, but once they have an outbreak or a mole or and a rash, then it's like, ooh, rush to the doctor.
Yeah.
Um, so I'm sure you see a lot of that. There's like the vanity, I guess you could say, of it. But what are the most common things, common complaints, or common conditions that you see as a dermatologist?
It varies regionally, but here in Colorado, we see skin cancer a lot. So lots of new bumps and moles, especially in our older population because of our lifestyle. We love to be outside, and we didn't always have great sunscreen. So that acne, bread and butter, we always have teenagers have acne. And then eczema is another big thing. So dry, itchy, rashy skin here in Colorado. Those
Mhm,
are those are the big things that we see.
mhm. And Uh, the other thing, like, I'm curious about is I mean, I don't really look at the letters after doctors' names, like
Uh-huh.
DO, MD, ND, like,
Yeah.
I don't but I feel like I don't know I don't think I know any other dermatology DOs.
Yeah,
Uh,
I don't think so. In the state of Colorado, I would say there's a handful of us.
oh, cool.
There's none in this valley. There's a couple of good friends of mine in Boulder are DOs. I have a good friend in Durango who's a DO, and then yeah, a handful scattered throughout the Denver metro area. So
Oh,
yeah,
cool.
there's not a lot of DO dermatologists.
And how does that inform your practice as a dermatologist? You talked about there's a little bit more of a holistic education, and do you find that you're able to draw upon your osteopathic roots in dermatology practice?
Absolutely. I think it allows me to offer something else to patients, another way of healing and caring for patients, which I think a lot of people really appreciate. Like for example, if you look at an acne patient, sometimes parents don't want to put their kids on medicine right away. They don't want to do an antibiotic. They want to know, is there something else that they can be doing from a more holistic, natural approach? And I'm very open to that, whereas a lot of doctors might say, no, this is the only way to treat acne that I know of. Where I've learned, actually there are other ways you can treat acne. Let's start with, some basics of like how you wash your face, what you touch, and then let's talk about your diet and your lifestyle. Are you stressed out? Are you eating healthy? Are you eating fast food every day? Those things will affect your acne, and we might be able to get it under control without using any medicine if you follow some more natural approaches. And so I know that a lot of parents are very grateful that we can have that conversation and I don't shut down or tell them to go somewhere else. So that's one way that I definitely approach it. I just I know that your entire body is connected. So it starts with the way what you eat, what you do every day, your stress levels, and that is manifested in your skin, whether it's acne, rashes, eczema, things like that.
Hmm.
And if you have a really severe case, I'm not saying that eating carrots is going to get rid of your cystic acne, but over time it may allow us to decrease the amount of medicine that we need, or you might not have to be on it as long. So
Right.
those are ways that I approach it.
Yeah, great. Well, I definitely want to kind of dig into the different conditions that I think, like you said, it's kind of regionally based what presents itself in the clinic most often. But I think we can probably agree that, like, acne, eczema are pretty universal, right?
Yeah.
So maybe starting there, like starting with acne. I know I've kind of have outbreaks every once in a while, and I know at this point why I'll get a zit here and there. It's like,
Yeah.
okay, I was stressed last week and here it
Yeah.
is. Or I ate that sugary muffin and here it
Yeah.
is. So I'm curious, like, from a pathological perspective, what is really going on when we have an acne outbreak, and how can we
Yeah.
address and look at the so-called underlying
Yeah.
cause?
Well, traditionally, we've always looked at acne as having four basic pathologies. One being, hormones, overgrowth of bacteria, inflammation, and then your clogged pores. And so traditionally, we've treated it with antibiotics to treat those overgrowth of bacteria, and then a retin-A or some sort of like topical that gets rid of clogged pores. And we've kind of ignored the hormones and the stress level or the inflammation because they're not as easy to treat. Or maybe it's more of a farm thing and we just had certain drugs available for us, who knows. And
Yeah.
also the science too, as a physician I have to tr- treat from a scientific approach. Where's the research? um, and so there are now a handful of papers and research studies that show hormones, whether it's stress, changes in life, do influence acne to a huge degree. And they really drive that oil gland and the overproduction of oil glands, which then feeds the bacteria. So if you can decrease cortisol levels, decrease stress in a different way, you can kind of decrease that overgrowth of bacteria in a natural way. And then inflammation. Inflammation is always kind of the underlying, when you see those big red cystic acne bumps, if you can decrease that, your acne is going to improve too. And we know that there's a huge gut-skin relationship. And so certain foods cause a lot of inflammation. Over processed foods, huge inflammatory response, which then gets manifested on our skin. And it's funny because when I was training, a lot of doctors would say there's no evidence whatsoever that chocolate causes acne. Like that was the mantra that I was taught. And every mom comes in, my child eats chocolate and they break out. For years we've heard
Yeah.
this. Well, I can now say, and there's scientific evidence, the moms were right. You recognize that your child eats chocolate or they eat, cheese pizza, whatever it is that really gets them inflamed, and they break out a week later.
Hmm.
So,
And
and
so
there's a
just to
couple,
clarify, because
yeah,
I'm a little bit of a chocoholic, admittedly,
okay,
and I like cacao, like cacao
yeah,
nibs, cacao powder and stuff. And in the chocolate, is it the cacao or is it the milk and sugar?
the milk
That
and sugar,
okay.
absolutely,
Thank
yeah.
goodness.
Yeah, so you can still have like your nice dark chocolate that's, very natural and not so overproduced, but it's definitely like the Snickers bar that's, mass produced, has lots of artificial stuff in it. That
Yeah.
there's a difference there for sure.
Yeah, thank goodness, because I have
Yeah.
heard that rumor, I guess, if you will, about chocolate, and I think it gets people associate, like, me, I know that chocolate comes from a bean that grows on a
Yeah.
tree, and then it somehow makes its way into a Snickers bar, and there's a difference between chocolate and a
Yeah.
Snickers bar, or cacao and a Snickers bar. Thank goodness.
Yeah.
Um, so it sounds like, if I understand accurately, that really the underlying cause of acne, like if it was all to boil it all down to one thing, it's kind of hormones.
Hmm.
And then the hormones drive this and that, and
Yeah.
hormones and inflammation.
Yeah. Which is why women in their 30s and 40s end up getting really bad acne and they've never had it before in their life. It's
Yeah.
changes in hormones.
And
So,
I remember learning in, naturopathic medical school and dermatology, and my, limited
mhm.
exposure to the pathology, uh, there's this connection between the liver and the health of the liver and the skin and acne.
uh
And, like, what could you speak at all any more to that?
um, I, don't- I, I don't know of anything specific, uh, except for that everything is so interrelated, and the liver
Yeah.
is so important in detoxifying and getting rid of all the impurities and inflammation. And so maybe from that standpoint, it could play a huge role in decreasing inflammation or not if it's overloaded
Hmm.
with
Yeah.
too much stuff that it's processing.
The liver's got a full-time job,
Yes.
especially in our world today.
Yeah. Yeah. It's
Yeah.
funny. Yeah, we haven't really addressed how the liver plays a role in acne. I haven't
Yeah.
heard that before. So it's a good question that I don't know. I don't have a great answer for you right now. That's just my quick
That's all right.
theory.
And yeah, and the other thing that I remember learning is kind of different patterns of outbreaks, and I remember learning that, like, the jawline is kinda like a hormonal,
Yes.
thing,
Yeah.
and is there any scientific truth to that, and like, where we get our outbreaks and what it means?
I don't know why, but yes, we do see that with women in their 30s and 40s. They tend to get more of the cystic acne here, and we feel like they respond better to hormone medications than they do to like an antibiotic. Like if you gave them an antibiotic, it probably will not clear up their acne. So because it's just not working on the right pathology there.
Yeah.
So you're right. There absolutely is this patterned type of acne. Teenagers tend to get it, forehead, chin, maybe a little bit on the cheeks. But the underlying reason why is still kind of an unknown. It just helps us address how best to treat it in that form.
Mhm. And then I assume also, like, other parts of the body, does that mean anything different than on our
It could mean
face?
a couple things. Hormones again tend to be like chest and upper back. Just a really inflammatory response. Usually more testosterone driven is what I see in that. And then the other thing too is sometimes you have a little overgrowth of staph. So sometimes you'll see a triad of like eczema, acne, and a folliculitis. And so if you kind of address the overgrowth of staph in that patient, they tend to do better.
Mhm. And, so moving, I don't know, maybe moving into, like, the addressing things from
Uh-huh.
a natural perspective, what's really, because, like, you mentioned the hormones and the overgrowth of bacteria and oil being kind of what's going on physiologically. So how do we correct that,
Yeah.
naturally?
Diet and stress levels are the big key changers for most people.
Oh,
And
well, duh.
I think it's important to note too, while diet and sleep and stress levels are probably the driving force for most of this, it's hard to tell a teenager that because it could take 6 to 12 months for them to see any changes if they made these lifestyle changes. So But if you can do that and successfully kind of change your pathology in your skin, you're going to have longer lasting effects and much clearer skin for, duration, as opposed to the medicine I give you could help clear it up quickly, but your duration might not be as long if you haven't made any lifestyle changes. So I like to use them in conjunction a lot of times. But for, I think getting on a good sleep schedule is important. Go to bed at a certain time, wake up at a certain time, make sure you're getting adequate sleep. That decreases those cortisol levels. And it's not always possible for everyone, but if you can be mindful of it, it does help over time. And then food, just plant-based food is so important. Avoiding over-processed foods. And if you just can't get away from it 100%, even decreasing the amount of processed foods you eat can make a difference in your acne.
Yeah, and
But yeah,
I've
go
seen a
ahead.
lot of research connecting dairy specifically, like dairy and eggs, I think specifically to acne.
Yes.
Have you seen that clinically?
I haven't seen it clinically, but that was one of the first articles that came out that really associated diet with acne. They did a epidemiology study on like this, two populations, one in New Guinea and one in like Papua New Guinea, Borneo. And so there were two like isolated populations, and there was like no acne. Nobody got acne. And so they kind of looked what was the underlying factor in these two populations, and it was, the plant-based, no processed, and they specifically looked at dairy with them. They didn't drink any dairy. So then they did another study and said, well, what happens if we give kids dairy, and what if we take it away? Yeah, and skim milk is the worst offender because it's over processed, it's hormone laden, it's awful. Cow's milk is horrible for acne. It's horrible for our body if you think about it. So yeah, I'm a big proponent. If you have to drink milk, limit the intake, drink the whole milk, the natural, and get grass fed. If you can avoid it, go to almond milk, oat milk, some other alternative, that is appropriate.
Well, does grass-fed like organic milk have any less hormones or
I've
just different
heard that
hormones? Yeah.
I've heard it does have less hormones, but it still has. Because cow's milk is made to help sustain baby cows, so
Yeah.
it's full of hormones. It's what
Yeah.
it does. It's not meant for human beings for very long.
Or at all. Yeah, I don't know. It's
Yeah,
questionable.
I agree. I don't give my kids milk. I never have. Just human milk. That's it until they're old enough to have their own water.
Yeah, and well, you're safe, by the way, on this podcast, expressing your
Okay.
beliefs and the science as clearly
Yeah.
as you want or need. We're definitely whole food, plant-based advocates over here.
Yeah.
So,
Oh,
hey there.
sorry.
That's all right.
She needs a family hug. This is my daughter. Sorry.
That's all
Okay.
right.
Say
Hey.
hi and then say goodbye.
Hi.
Hey, can you tell them what your favorite food is?
My favorite food is noodles.
Oh, noodles and broccoli.
Oh, add the broccoli for sure.
All right. Bye, guys. Sorry.
That's all right. Cute cameo.
I know I was going to go into the office today, but with the snow and everything, I was like, we'll just do it from home. We can do this.
No worries at all. We're cool with that. So, all right. So the diet and lifestyle thing for acne, obviously huge. And I'm curious about kind of the topical thing. I know a lot of people just turn to creams and soaps and topical stuff. And
Yeah.
how should we maybe think about balancing and relating with like kind of the inside environment with what's going on the outside?
Yeah, very much. It's a fine balance for sure because, well, being in Colorado, it's very dry, so we usually need to put something on our skin to help kind of replenish some of the loss of lipids and loss of water. And we also know that retin-As are very powerful at helping with acne, preventing skin cancer. There's studies showing that they actually repair DNA damage from UV rays. So there are certain things that I feel like are safe and very effective at helping with our acne. But yeah, you don't want to, there is so much stuff on the market that is just laden with chemicals. It can actually worsen, a lot of inflammation, worsen the acne, cause contact dermatitis, cause eczema. So I always caution patients to really read labels, and less is more. So you need something with very few ingredients in it. And basically all you need is a face wash that's very gentle and hydrating on your skin, and then a good moisturizer, and maybe a retin-A at the most. And
So
that's
what
kind
is a
of,
retin-A for those, like, what does that mean for those of us who
uh,
don't know?
retin-A it's actually vitamin A, high dose vitamin A. And we have a couple of different formulations like Tazorac, different tretinoin, all these different brand name medications, but it's a very powerful topical medication that actually helps to remove the top layer of skin. So it helps to unclog pores.
Hmm,
That's one mechanism that it does. So for acne, we use it a lot to help with those clogged pores.
got
Also
it.
helps with fine lines and wrinkles, so women love it.
Cool. I'm curious. My wife introduced me several years ago to the caveman protocol, caveman regimen.
Oh,
Do you know about this
no,
as a
tell me.
dermatologist? It's essentially like the program is just going like for a month, I think, is the time frame that you're supposed to give, of not touching your face, not putting anything on your face, like not even water if possible.
Yeah. Oh,
and then
wow.
and then you like, you kind of like shed a layer of skin
Yeah.
naturally, and the whole idea is that you're reestablishing the healthy microbiome of the skin
Yeah.
and establishing the pH mantle of the
Yeah.
skin.
I would imagine so. So tell me, did you do it for the whole month?
I did my best, and it's certainly, I'm kind of a picker and a
Yeah.
scratcher, and like if I ever have a blemish, and then it becomes inflamed, because obviously we can inflame ourselves from the outside. So I tended to do that, so it kind of helps to train myself to be more mindful of when I touch my skin and pick things.
Yeah.
Um, and I would say
It's
that my
good
skin
for the
cleared up.
coronavirus right now, huh? You don't touch
Yeah, especially with that, like, skin face touching.
your
Yeah, but I know my wife, she had pretty dramatic benefits from doing that. As yeah, and yeah,
Yeah, it's kind of like a cleanse for your face. I like that idea, actually.
like a
If I could
fast or
get,
something.
yeah, if I could get all my patients to stop their 100 million products, it would be lovely. They bring in bags of stuff and they've spent so much money, and I just, unfortunately, most of it is actually probably causing more harm than good. Um, yeah,
The same thing
but I like
happens to
that.
me with like supplements and things, like, oh, I
Oh,
got
yeah,
someone recommended this, and before we
yeah,
know it, we got a like cabinet full of stuff.
yeah.
Yeah.
It's exactly the same. People are inundated with all this information that's supposed to help with their health, and really, it's very simple. If you eat well, drink water, yeah, don't pick at your face too much, implement a few really good habits, your overall health, skin health is going to be better, and health in general will be better.
And maybe
Uh,
save some money on the supplements
Save a
and
lot of
creams.
money. Yeah,
Yeah, it's amazing how expensive facial or skincare products are, like the higher end
yeah.
ones. I mean, I think my mom has spent like a couple $100 on tubes before.
Oh, yeah.
Do you think
Well,
is it just because like they can get away with that because people are kind of vain?
yes and no. I mean, a lot of time, if you go to Aspen, my primary office is in Aspen, and there's a couple of very high-end retail shops there. And yeah, they just I don't know how they can charge so much money. They basically say they have like gold dust in their products, and there's no science behind that whatsoever. And so they can charge up to $3,000 for a bottle of lotion that does nothing, and people buy it. Um, and then there are some companies who actually they do a lot of research and development in their products, and there's a couple of great products out there that have like growth factors and stem cells, and they do make a small improvement over time, I think. But it's, again, how much are you willing to spend, how much can you spend to maintain that, because as soon as you stop using that product, you're not going to get that benefit for much longer.
Yeah. And
um,
I always think about, you brought up before the power of diet and lifestyle. And it's like if we are just kind of putting band-aids on and
yeah.
managing the symptoms, meanwhile, we've got all this inner turmoil and pathology and inflammation going on systemically inside. If it's not going to manifest on the skin, then maybe it's an autoimmune condition down the line, or
Hmm.
cancer, or heart
Yeah.
disease, or whatever else.
Yeah, exactly.
Yes. So, shifting into eczema land,
Uh-huh.
um, when eczema is super common and
Yes.
to various degrees, low grade or severe. What's going on when people experience eczema? What's kind of the underlying
Well,
pathology?
it's really interesting because it's very similar to acne, actually. It's stress and inflammation. Those are the two biggest drivers of eczema. There's certain patient populations who are more predisposed to it. And studies show that those patients usually are missing some lipids or some proteins in their skin that predisposes them to dry, cracked, irritable skin. So then if you overwash your hands, you live in a dry climate, or you get really stressed out because coronavirus is everywhere and you're washing your hands 50 times a day, your eczema will flare really badly. And that's all I've seen this week is really bad eczema that
Mm.
has been, and in a couple of cases has become like overgrown with staph infection as well. So I've had some really like severe eczema this week, which is just, it's out of proportion with the number of cases that I normally see. And I really think the driving factor is the stress level that a lot of people are under the last few weeks with everything going on in our world. So yeah,
Yeah.
eczema, again, calm down, put some lotion on,
Yeah,
breathe.
and are there any specific foods that aggravate eczema in your experience or in the science?
Um, there's not one particular one. Again, the milk and eggs, dairy thing we think is driving some of it. We see there's been some kind of iffy studies in kids with eczema that it shows maybe there's a little bit of a shift towards eczema with those people who are more sensitive, but not necessarily. I think, again, it's really individual. And if you notice every time you have a glass of milk, your eczema flares, well, then
Mm.
for you, that's the answer. But there's not like one universal truth for eczema,
Mhm.
unfortunately.
Yeah, and then topical. I mean, the kind of conventional thing is just steroids, and
Steroids. Yeah, I know.
uh, how well do
Ac-
those work? Like, do they stop working eventually, or do they?
yes, so you can get this thing called tachyphylaxis, where if you've overused a steroid, you actually become somewhat immune to it. Um, so yeah, you don't want to overuse your steroid. I love steroids. I mean, I'm a dermatologist. There's a million jokes about what derms do, and all we do is give steroids, right?
Well,
So
my father-in-law works with some dermatologists. Sometimes he's in another industry, but he made a joke that if it's wet, you dry it. If it's dry, you wet it, or something like
yeah,
that.
yeah. Uh, yeah, but I mean, really, the steroids do help, because what they're essentially doing is they're calming down that inflammation very quickly and allowing the skin to heal. But yeah, you'll flare back up, and then you'll use the steroid again. And so what you have to do is kind of break that pattern. And so I think that's the key. How do you do that and not become immune to the steroid and still have the steroid available for when you do flare? My hope is that most of my patients will only flare when seasons change. So, at the beginning of winter or when spring breaks, those are two big times. Just because the weather is so dry and cold at that point, yeah, use your steroid for a week or two if you really need to. The rest of the time, we need to find, a really good, safe lotion or moisturizer that you can use, and make sure that your stress levels are calm during those times. So
Yeah.
patients are always saying, they recognize it too. They say, I'm really stressed out this week and my eczema flared.
Yeah. So aside from this tachyphylaxis, is there
Mhm.
any other risk for like steroid use too much, relying on steroids? I remember learning about like thinning of skin and
Yeah.
stuff like
So
that.
if you use it for a prolonged period of time on the same area, you can get thinning of skin, you can get overgrowth of blood vessels, um, and then uh, if you have a large body surface area that you're putting it on, we usually say right around 35% or greater, you can get systemic absorption of
Right.
the medicine as well. If you use it near your eyes, you could get glaucoma, so steroid-induced glaucoma. So there are definitely some real risks to consider when you're using it. So you really need to pay attention to directions that are given to you. If it's not working, you need to let your doctor know. And you need to, I usually use it intermittently. So I come up with some sort of schedule where they can use it, 5 days on, 2 days off, 2 weeks on, 2 weeks off. And then I give them something that's either non-steroidal or a lower dose to use on those days off, so that we're still getting the inflammation under control as quick as possible without causing harmful effects from the steroid. And I'm not afraid to use a steroid. I think it's just educating patients and parents on how to use it correctly. I've had like babies are really hard because they can get full body eczema. They're crying, they're miserable, they're not feeding well. So that's a type of person that I really need to get under control quickly. I need to educate the patient, the parents, that it's safe to use this medication for this amount of time. I need to see you back in a week or two just to make sure that we're on the right path, and you're not getting worse, and you don't have a staph overgrowth. There's just a lot of things to consider. So, but
Hmm.
you can use them safely, and hopefully for just short periods of time.
Hmm. And you
I have
mentioned,
pretty, I have
you
pretty
go
bad
ahead.
eczema too, and
Oh,
so I always have a stash of a steroid on hand, and I rarely use it. But the second I feel my eczema, I put it on, and it usually like melts it away within seconds, and then I'm good to go.
yeah. So just like a kind of you're sensitive to the initial onset, and then you use a little bit, and that kind of quenches the fire.
Hmm. Exactly.
Yeah. Well, you mentioned a few times about being aware and mindful of the topical ingredients that
Hmm.
we might find in lotions and ointments and creams and stuff like that. What, as a consumer, what do we really need to be looking out for when it comes to putting things on our skin? We kind of have an extreme philosophy in our household that we don't like to put anything on our body that we wouldn't like put in our
Yes.
body.
Yeah.
But that might be a little like extreme for a lot of people. I don't know. Like, what are your thoughts, and what's kind of a good rule of thumb for consumers?
No, I think that's really good. So I always say, limit the number of ingredients, because the more ingredients, the more harmful, or possibility that there's more harmful things. Just like foods, you want to be able to pronounce all the names. And just because it says that it's natural does not mean it's not going to irritate your skin. I think that's a huge misconception, is that people say, oh, well, it's got mango, it's got chamomile, it's got lavender, and it's got like 50 ingredients in there. And I was like, and I think poison ivy is natural and nobody puts that on their skin. So you really have to be careful, because people can develop allergies to tea tree oil, to lavender. And so if you're putting 50 different things on your skin, you're really opening up Pandora's box of irritants that can be harmful. So I like very simple things, oils, coconut oil, just coconut oil. There's nothing else in there. If that's soothing, fabulous. If you need to add something else, well, then add something else. I like Vaseline. I know a lot of people don't, but Vaseline, again, is very simple. There's 1 or 2 ingredients in there, very simple. So if you do develop an irritation to it, you can eliminate it very quickly. What's the main cause?
Mhm.
Yeah, so that's my
Yeah.
philosophy.
So, like, I know that things can come through the skin. Like
Mhm.
the skin is a two-way street.
Yes.
Things are coming
Yeah.
in and going out. So what I've heard, I know that there's like a lipid membranes, and
Uh-huh.
what comes through the skin, and so what do we need to be careful of environmentally or in our house,
Yeah.
or soaps and stuff.
Well, I mean, theoretically, anything could get through the skin. The outer layer, the epidermis, is basically uh, a huge brick wall of dead skin cells or dying skin cells that is our armor. So its whole job is to keep those things out that are harmful. And then there's an amazing immune system too. So right under the epidermis, you've got your immune surveillance always going on. So if anything does get through your brick wall, you got your immune system there to quickly grab things up. Um, and so, I think one of the big examples recently in the news is sunscreens. People are very scared to put sunscreen on their skin because of the absorption of chemicals and zinc. And we have micronized zinc and titanium now so that it's easier to put on and it's, more pleasing for us, and it does a really great job of blocking the UV rays from penetrating our skin and causing skin cancers. But there is that real risk that they are micronized and they can now penetrate and be absorbed into our skin. So I'm a redhead. I've got melanoma in my family. I still put sunscreen on. I stick to, again, things with very few products, so zinc and titanium based products for my sunscreen, and I avoid all chemicals because I don't want to absorb them. I don't want to get a reaction to them. So I would say, the greater body surface area you're applying things to, the higher risk that you're going to absorb them.
Yeah. Well, I'm glad I definitely wanted to spend at least a few moments talking about like skin cancer and sun protection, uh,
Hmm.
um, especially as we move into maybe sunnier
Hmm.
days ahead
Yeah.
in more places. So, yeah, tell me about micronized zinc and titanium, because I am also aware of the zinc and titanium products being the safest, and avoiding, I think it's
Hmm.
like benzenes and stuff.
Yes.
Or
Yeah.
is that what it is that we need to avoid?
Oxybenzone, and yeah, there's a I'm forgetting the names right now, but
Me
anything
too.
anything you can't pronounce, yeah, those chemicals are have been shown to have a high risk of absorption and cause cancer. So
Yeah.
I avoid them. So
Yeah,
for sure.
so but there's a difference between zinc and titanium, and then the micronized zinc and titanium.
Mhm.
So
So
the
the
micronized can get through the skin potentially.
Potentially, yeah. If you apply it, enough and to a big enough area, probably what a dermatologist would recommend to apply, you're probably absorbing some of it. Um, but I always look at it like the risk of getting skin cancer, the risk of getting melanoma is still really high. And then our bodies are designed to help, you know, eliminate and detoxify. There's where the liver comes into play there. So, you've got a risk benefit ratio there of, what are you willing to accept as risk, and beneficial. We breathe in so much pollution every day. We eat a lot of crappy food every day. That probably carries a higher risk than putting some sunscreen on our skin. And that sunscreen does protect us. If I had darker skin and I could get away with using a less intense sunscreen, by all means, I might do that. I advocate 100% for clothing. Wear clothing, wear hats. they actually protect from the sun better than probably most sunscreens. So if you
Mhm.
can tolerate that, that's great.
Mhm.
Yeah, so a lot of there's still a lot unknown, I would say, and we have to look at the risk of getting melanoma, which is really high in Colorado. I think we have the third highest rate of melanoma, and melanoma is deadly, and it can metastasize quickly. So for me, that is a huge concern, and I want to prevent that. So I know sunscreen can.
Yeah,
So.
totally. Um, I've read somewhere, and I'm curious what your thoughts are, that there's more people dying or getting sick from not enough sun exposure than there is from overexposure. So the vitamin D thing, right?
Yeah. Um, so uh, I don't know. So the science behind vitamin D is really interesting. At most latitudes in North America, we actually don't really absorb enough vitamin D or the right type of vitamin D to synthesize that vitamin D in our bodies. So I think it's like a latitude of 23 degrees, which is like Charlotte, North Carolina, and above.
Hmm.
We just do not get the right rays of light, and
All times a year?
yeah,
Oh,
yeah.
wow.
Yeah. And so, yeah, absolutely. We probably do not have enough vitamin D, but I don't think sun is necessarily the right source for most of us. So I think I put a lot of my melanoma patients on a really high dose vitamin D regimen. I say take at least 2,000 units a day because I'm going to tell you to stay out of the sun. And then, yeah, you don't need a huge absorption. So if you are in a place like Florida where you can get some good sun exposure at the right latitude, you just need the backs of your hands for about 5 minutes, and that's
What?
enough to synthesize. Yeah, so you don't need to be naked. You don't need. So I think there's some misconceptions in the science literature about what's appropriate and what we need, and I learned all that from Moffitt Cancer Center. I did a melanoma research year there. So there's a huge team of epidemiologists and medical oncologists studying just melanoma. And so that was their take home point for me was, the vitamin D importance in overall health, it's definitely there, but you don't necessarily need to get it from sun. And most of us can't. So.
Yeah, well, I definitely knew that. For some reason, I had it in my mind that like Portland, Oregon was the latitude.
It could be. I might
Uh,
have it wrong. I have to go back and look at all my stuff. But
But in any case, wow, I didn't know that it was just the back of your hands that for 15 minutes, you said, is like
yeah, five
potentially
minutes.
five
Yeah,
minutes.
yeah,
That's enough vitamin
yeah,
D per day for
yeah,
most people if you're at the right latitude.
yeah,
Wow. Yeah, I learned something new today.
yeah. Good.
Because I definitely like to be like, if it's a sunny day, it's, I guess I've got a complexion that I, really don't burn. But my wife does. And
Yeah,
so, yeah, I'm a sun lover, but
I know. Well, we all are in Colorado, and
yeah.
I think it's important to appreciate that. And the sun in Colorado is just amazing. It feels so good. I get it. I
So,
love being
yeah.
outside.
So I'm curious about, besides being mindful of sun exposure, overexposure, um, what are really the things that we can do to reduce risk of skin cancer? And is there a difference between the risk reduction when it comes to melanoma or squamous cell or basal cell?
You know, yeah, there's been some interesting studies, and yeah, you've heard the spiel from every dermatologist about you're reducing your risks from wearing your hats and sunscreen and all that. But I will also tell you, since this is kind of a plant-based, really holistic approach to medicine and overall health, that antioxidants are huge. We know for squamous cell particularly, and you cannot take a supplement There's actually studies showing that taking antioxidants or multivitamin does not reduce your risk of squamous cell carcinoma, but eating plant-based foods with high antioxidants actually does reduce your risk of skin cancers, and specifically squamous cell carcinomas. So I think that's a very powerful study. And even though it hasn't been shown in melanoma or basal cell, I think it can be applied because it's the same immune system that's working on those types of skin cancers. And so overall, I think that you can apply that knowledge to other types of cancers as well, which we know support your immune system, and it helps you fight cancer, helps you prevent cancer, whether it's skin cancer or colon cancer.
Yes. I mean, antioxidant is such a buzzword, I think, in like marketing and all that kind of
Yeah,
stuff. But
yeah,
I think it's for good reason. It's
yeah,
it's and I think people forget that, like you said, antioxidants come from plants, and
yeah,
then they
yeah,
might be the constituents might be packaged into a capsule and then marketed.
yeah.
But I have to ask you because my I hope it's okay that I'm saying this on the podcast.
Oh yeah.
But my father-in-law, he's got a company that makes a product called HelioCare. Have you heard of it?
Oh, I love HelioCare. It's my favorite thing.
Oh my gosh,
Yeah, it's made from the fern
Fern
plant. Yeah, Polypodum locum something.
Leucotomos.
Yes, so I love that product. It helps prevent skin can or sunburns, and they've done some fantastic studies in people who have allergies or sensitivities to sun, and that it actually allows them to be in the sun without having adverse reactions. And so they translate that into, how does this affect a normal person? And used synergistically with sunscreen and good skin care, it really helps prevent sunburns.
Yeah,
And it's an antioxidant is
totally.
basically what they found.
Yeah,
I use it all the time. Love it. I
that's so
recommend it
cool.
all the time. I
I've
sell
had
it in my office. Yeah.
I've had a personal experience as well. I took it daily. I shouldn't. I don't take it every day like my father-in-law recommends,
Yeah.
but I did take it every day.
Dermatologists do. We all love it. It's the best thing ever.
Oh, that's so awesome. I did
Yeah.
take it every day when I was on a bicycle trip. This
That's
was
when
like
I first did it too. That
oh,
was my first.
I was on a bicycle tour like for a week or so,
Yeah.
summer days, and
Yeah.
I wouldn't necessarily ever get sunburned, but would always feel that sun fatigue, and
Yeah.
I didn't feel that at all when I was taking this
Yeah.
supplement.
Oh yeah. My husband and I biked around Costa Rica and Puerto Rico, and it, I mean, look at me. I should burn within minutes. I did not get a single sunburn, and I maybe reapplied my sunscreen once, and I swear it was because I just kept feeding my husband and I those every 4 hours. I was like, take another pill with your water,
That
and
is
I
so
swear it
cool.
works.
So yeah,
Yeah.
that my father-in-law makes that product. So
Awesome.
yeah, funny small world. Well, I know that they've got a new one, a
Yeah.
new product that has the NAD in it.
Yeah.
Yeah,
I haven't used it yet, but I love their products, so I'm sure it's great.
cool. Cool. I'm glad I could see your vote of approval because
Yeah.
and like back to the lifestyle thing, it's like, yes, it's an antioxidant and it doesn't replace your antioxidants from your nutrition.
Yeah.
It's just a supplement.
Yeah.
Supplements are called supplements because they supplement something,
Yeah.
you know?
Yeah, exactly.
Yeah.
Yeah. Oh
Cool.
yeah. So another interesting thing, I always have to put this in there. So when I talk about, how food can prevent skin cancers and why the supplements don't work, there's something that we just don't understand about the antioxidants and how they work synergistically with other things that are in the food.
Yeah.
There's so many other uh, minerals and vitamins that are in the food, and somehow the powerhouse of the whole plant, and when I say antioxidants, I'm often thinking of something specific, like a blueberry or a raspberry. It's like there's something so rich in that fruit or the vegetables and the way it works in our bodies is still so unknown. But we do know that that we can't supplement it at all. It's just crazy. I think it's so fascinating, and our bodies are just so complex that there's still so much to learn. So, but
Absolutely.
the fundamentals of it is that, we are given this world with so many rich foods, and you should just really enjoy what we have, because that's meant to nourish us in a way that we just don't understand completely. Keeps us healthy and vital and prevents disease. So,
Amen.
yeah.
Amen. And I'm not sure that we ever will
uh,
understand things
oh God, no.
completely,
I hope we
because
don't. Life would get boring.
I'm in that camp as well. I think, I mean, because science inherently is reductionistic, and we pick things
Hmm.
apart and study things in depth. But
Yeah.
as you were speaking, my favorite all-time nutrition book is Whole. Have you read that one?
Uh-huh.
By T. Colin
Yeah.
Campbell's
Yeah.
and Howard Jacobson, and that speaks to the complexity of whole foods and the interconnectedness of all the constituents. And yeah, it's just a beautiful thing that nature provides,
Yeah.
medicine everywhere.
Yeah. Absolutely.
Yeah, well, I feel like that's a pretty good place to wrap things up here. And
Okay.
I'm curious if if you've got any kind of last words of advice or recommendation when it comes to holistic, natural skin health and prevention. Anything that maybe we didn't cover as much as you'd like for people to take away?
I think um, uh, we all have an inherent knowledge of what we need, and sometimes we don't listen to that. So I feel like our bodies sometimes speak to us of what we need, and I see it in my 3-year-old who you guys met earlier. She can tell me, she needs a certain food one day, and I've really observed this as she's grown up, that as she's growing, she needs certain nutrients and she'll crave that. And somehow we lose that as adults. When she's not hungry, she doesn't eat, and I don't force it. And as adults, I think we sometimes forget to listen to our bodies and what it is that we need to nourish our souls. And I think if we can get back to that, you create better health, and it'll be manifested on your skin easily. So, yeah.
Totally.
Be
Yeah.
mindful of everything you do.
Amen to that as well. And for people to, maybe read more about you and learn about you, and maybe have a consult with you if they're local in the area, where can they find you?
On my website, it's at aspencosmeticmedicine.com. And yeah, right now I am offering virtual exams if you have any skin problems. So you don't have to go out and about. And it's easy to do, online consult right on my website. So.
You're offering virtual skin exams.
Well, not
Is that what
skin
you said?
exams.
Oh,
Yeah, that's too hard. But like,
yeah.
if there's a specific problem or something that I feel like we could help, address virtually, absolutely.
Cool.
So yeah, it's
Yeah,
just a
I
way
was
that
like,
we can help.
I thought you said skin exams, and I was like, that's got to be kind of tough.
Yeah, yeah. But we can help with things like acne and
Yeah.
eczema, and I can help provide some relief, because those things they can change your quality of life. And if you can't go to the doctor and you can't go to the ER right now, it's hard. So,
Yeah. Totally. Well, thank you, Dr. Brooke Walls, and
you're welcome. Thank you.
aspencosmeticmedicine.com for more, right?
Yes. Yeah.
Cool. All right. Well, peace and love, and we'll see you guys next time.
All right. Be well. Thank you.